We're on to our final session about emergency service response. So our first speaker is Anton Stephenson from the Police Service of Scotland. Now my note says he's been a police officer for 25 years, but looking at him I think that must be a typing error. He heads up 4 teams within the Partnerships, Preventions and Community Wellbeing Division, which includes the Substance Harm Prevention Team, and the Naloxone Coordination Unit. He's been very involved in the rollout of Naloxone to Police Scotland, which we heard from the Minister this morning was being officially rolled out force-wide today. And so I invite Anton to come and speak to us. Thanks.
Thanks, David. Good afternoon. It's quite unusual for me as a police officer to stand in a room and give people good news. It's very, very rare that we're here to tell you something cheerful. But this is a good news story for us today, and hopefully technology doesn't let me down. So I'm going to have a quick run through of where we were, where we are and where we're going with Naloxone and kind of why we did this. And we are in a good place, and it's thanks, in no small terms at all, to a number of people sitting in this room. They know who they are. There's a lot of people did a lot of work to help get this over the line, and there was a lot of people put in an awful lot of hours. I'm looking at Kirsten sitting here in the front, to deliver this training to our officers. It was just over 2 years ago that ACC Gary Ritchie gave me the job of delivering a test of change, or for those of us who speak old language, a pilot, for the police carriage and use of intranasal naloxone. Now, it had been on the agenda for quite a while, but I think one of the biggest changes for us is when intranasal naloxone became available. Officers really didn't feel comfortable carrying the needles, the injector kits, and I think that's probably the same for a lot of people, is that the intranasal option is something that's far more comfortable for them. I'll not go through death by PowerPoint here, folks. You can see the statistics for yourself. But I think one of the most important things to mention here is the test to change area, or the pilot areas, was the east end of Glasgow, Dundee City and Falkirk. And that was 808 officers trained, 81% of them volunteered to take part. And you're probably wondering, why did we do it voluntary for this period? And there was a number of reasons for that. One of them was, and I'll come on to the evaluation in just a minute, is we wanted to identify barriers to police officers carrying and using naloxone, and we wanted to identify stigmas within our own organisation. I can't do that if I tell you to do it and instruct you to go out and do it. And that's quite unusual in policing. We are a rank structured organisation. Normally we have a policy. There's your kit. This is how you use it. This is what you do, and you go out and apply it. So for the officers to have the opportunity to make an informed choice was quite unusual. And to some officers, that was a barrier to them carrying naloxone. Why am I being given a choice? I'm awfully suspicious here. Normally I'm just helped and I go and get on with it. And that's genuinely some of the feedback that we've had as to why they didn't volunteer. So when we got to the end of that and we had some leftover kit, we extended it to a number of other areas, which was the community policing team in Stirling, into our custody centres within the test bed areas, because our officers who work in custody have a very, very different role and responsibility. It's all about care and welfare of people. They're not out there apprehending people or dealing with the calls. It's all about care and welfare. And also to equip officers up in Caithness to give us a very different perspective of an isolated, very rural community who are quite detached from a lot of services. During the 6-month period that it ran, as you can see there, we had 53 administrations of naloxone in a 6-month period. That number's now in excess of 80, and that's despite the fact that there's less than 4% of our police officers carrying them at the moment. So if you scale that up across Police Scotland to the 12,500 that are going to be equipped in the coming months, I think we'll all accept that there's going to be quite a significant number of uses there. During that 6 months, thankfully, everybody that was administered naloxone by the police officers survived their ordeal, which is a good news story. Sadly, we have had 2 people who didn't survive. The officers were very much of the opinion that when they arrived, the person was sadly deceased, but they administered it anyway to give the person the best possible chance of survival, which is absolutely the right thing to do. and it's working. So it's probably quite important to touch on the circumstances officers are using this in. You see there's a mixture of things. There's calls from members of the public for help, or officers just discovering a casualty whilst out on foot patrol in all sorts of environments. We've had people becoming unconscious in the back of police cars or in the cells. People during siege incidents. Unfortunately, sieges are not uncommon for us, but people who have consumed drugs, and when we've gone into the house, the person's been unconscious. And I think one of the most important ones is the last one, is deliberate overdoses by high-risk missing people. And in these circumstances, it has been prescription medication for people in absolute mental health crisis. And I think everybody in this room would agree it's very rare for substance issues to present on their own. And if ever there was evidence of it, that's it right there, is that these are people who were intent on ending their lives, but they've now been able to be linked in for support. As I said, naloxone has behaved exactly as it's expected to on every occasion. That was a concern for officers, that can we do harm with this? Will we hurt people giving them this? We're not used to administering medications. So that was a worry. And the ambulance service response was another worry. They were concerned, are we stepping in to a medical role here? Are we taking over from ambulances? And the ambulance service were very clear from day one, we won't downgrade an ambulance just because a police officer is there. Our response is based on a clinical triage of the patient, not who's standing next to them. What's the needs of the person, not the needs of the police officer standing next to them. And that is absolutely critical. And the response from the ambulance service has been absolutely outstanding. We couldn't have asked for more. And what was really evident to me through the circumstances that they're using it is this is not the police taking on a medical role. They're taking a medical response to a space that we're already in. If we've had to use it 81 times already, it tells you we're already in that space. So we should have the right response when we're in there dealing with it. Courtesy of the Drugs Death Task Force, an independent evaluation was set up. I don't intend to read through all of these here, but basically to examine the 6-month test of change. And lived and living experience was a really, really important part of that, as they interviewed community stakeholders about their views, their perceptions of police officers. What's your view of the officers carrying and using this, as well as the officers' attitudes and the barriers? And unfortunately, some stigma did come out in that, is that there were some stigmatising views, not wholesale, not everybody, and thankfully a minority, but the fact is it does exist, and we have to acknowledge that it does exist in our organisation. However, what was also really reassuring to me is that where officers had concerns about naloxone, will it hurt this person, will something bad happen to him, am I going to be liable if they don't survive? That wasn't a barrier to them. Their overriding commitment was that to save life. And that came across really, really clearly when the evaluation team were interviewing the officers. And as I say, it was completely independent to us. I'll not deny I was quite nervous the night before it came out, because I had no idea what these officers had all been saying when they went into this evaluation team. There was group sessions, there was one-to-ones, and there was surveys sent out, so they could have said anything. But the overriding principle for them was their duty to save a life, which I think is sometimes lost, and we don't hear that amongst all the other noise that comes with policing, is that our primary responsibility is the preservation of life. That's first and foremost the responsibility of a police officer, is to preserve life, and this is an excellent way of doing it. But you also see, you maybe noticed already, there's a few quotes at the bottom from police officers, but there's also a few quotes from members of the public through SFAD as to why they've started accessing naloxone, and it's on the back of seeing the police officers carrying it out and about in communities. So on the back of the evaluation, the Chief Constable approved a national carriage of naloxone. The Scottish Government have fully funded this for us, and it'll be all officers up to and including the rank of Inspector. More senior officers, I said, we can get trained if we want, but the priority is the people out in the front line, the people in our communities who are patrolling 24/7 in and around society who are likely to encounter this. Naloxone will be standard issue kit for every police officer in Scotland, and it will be high profile carriage. And the reason for that is to start challenging those stigmas. They will all have a pouch on their utility belts or on the new vests as they're coming through. It has a first aid symbol on it, and it says naloxone across it. You can't miss it. And there's been a number of accidental knock-on benefits from that we weren't expecting, if I'm being quite honest. like I said, the SVAD have had a lot of feedback that people have said, I saw the cops carrying it, so if they'll carry it, I'll carry it. So great. But we've had bus companies saying, I saw these 2 cops came onto the bus. Where do we get that? With security guards in Glasgow asking for it, saying if the cops are allowed to carry it, can I carry it as well? And the various organisations in this room, we've been able to link them in and issue these people with naloxone. This goes on. So we do have I was looking forward to saying this and then the Minister stole my thunder. The most important thing was to get everybody in the original testbed areas who was already trained, equipped with their naloxone, and they do have that now. I'm delighted to say that we have started phase 4, so officers in Stornoway, some of our most remote locations, received a naloxone from the ACC this morning. Officers in Greenock and Paisley as well received their naloxone and their pouches and are out carrying it in a high profile manner. And in the coming months, as the kit starts to arrive into the country, we'll go from where we were 2 years ago, which was nobody, to approximately 12,500 officers carrying it out on the front line, which I think is a great place for us to be in. As I said, the Scottish Government has fully funded it, including the pouches, and through the local health boards, they'll supply us with our naloxone and on a rolling basis for the future. I think at £26 a kit, it's not a lot to pay to save a life, is it? When you look at all the other equipment that police officers carry out there. And what was quite nice is that you see the quote at the bottom that somebody's cousin's a cop and carries this, and they can. So they said anybody can carry it as well. So if the cops are going to carry it, so will I. So Susie kindly sent them it through the post, and they've got their naloxone as well, which I think is a great place for us to be in. What we have done to support it is we have, or I'm saying we, us and Kirsten, have trained a number of naloxone champions up and down the country to promote naloxone amongst our officers. Moodle, it's an online platform. I probably shouldn't have put that in there. We do have a bespoke Moodle training package that the Scottish Drugs Forum helped us develop. It's the same as what the public would undertake in terms of how, why, what, in terms of naloxone, and then in terms of there's an add-on bit at the end for police procedures that anyone who's administered naloxone by a police officer should be subject of a vulnerable persons report to refer them on for help from other agencies. And that was a considerable bit of the feedback from the cops. A lot of the cops in the evaluation said, okay, we administer naloxone, but we need someone to come along at the back of us and help this person so that we're not back here in the same situation again tomorrow. We need to break the cycle. And again, that gave me a lot of heart that that's how our cops are thinking out there, that there needs to be something coming along at the back. But also built into that is the Scottish Drugs Forum's stigma training as well. So every officer in Scotland will go through that stigma training. It will be refreshed every 12 months. And once every officer in the country has been trained, the Scottish Police College will start training every single officer at the point of recruitment. So when their equipment arrives as standard, it will have naloxone on the belt. They will go through naloxone training and they will go through stigma training all at the same time, which will be refreshed every year for the rest of their police careers, which I think from where we were is light years to get to this point. Like I said, it hasn't been without its challenges. It sounds dead simple. Get some naloxone, stick it on their belts and off you go. If it had been that simple, then I probably wouldn't be standing here because it would have been a much easier process. However, we have got there. It has worked very, very well. And I hope in 2 or 3 years' time, this isn't even a matter of debate or even a subject for the police to even discuss. That will just be our culture. It will be part of what we do as the recruits come through the college, as they go out into their communities. They'll be carrying naloxone because they've always carried naloxone, like we've always carried our battens, cuffs and our other sprays. That's just what we do. And hopefully that really does change our culture in policing. I'm conscious of time, but thank you for your time, everybody. And